In the world of cardiology, every single second counts. So what happens when your most critical tool, the patient's information, is scattered all over the place, hard to understand and slow to get to? Well, today, we're diving into how a huge shift in technology is fundamentally changing the very heartbeat of cardiac care.
To really understand what's at stake here, we have to start with the sheer scale of the problem. Cardiovascular disease is the #1 cause of death around the world. It's responsible for a staggering 32% of all global deaths. And look, that's not just a statistic. It represents this immense daily pressure on cardiologists to deliver the absolute best care possible.
And this quote right here, it just gets to the heart of it all. In a field where you're making split-second decisions, like diagnosing a heart attack or managing chronic heart failure, having the right information right then and there is, well, it's everything. A single missing detail can literally change the outcome for a patient. So this brings us to the central challenge. You see, cardiology is an incredibly data-intensive field. We're talking about a constant flood of really complex information for every single patient. The real problem isn't the data itself, it's figuring out how to manage it all. Which leads us to the key question we're tackling today. How can a clinic possibly manage this absolute avalanche of data when they're also in a constant race against the clock? It's this intense dual pressure of volume and urgency.
To really get our heads around this, we need to break it down. So let's walk through the 5 biggest pain points, the daily struggles that cardiology practices face when they're stuck with outdated or just plain inefficient systems.
First up, the sheer volume and complexity of the data. Think about it. A single heart patient generates a mountain of information, from EKGs and echocardiograms to lab results and data from their pacemaker. When all that information lives in separate systems, or even worse, in paper files, trying to see the full picture is next to impossible. Second, you have the urgent need for speed. In a cardiac emergency, a doctor needs a patient's entire history, their meds, the recent tests, right now. Wasting precious minutes digging through paper charts or logging into 3 different pieces of software can have a direct and serious impact on that patient's outcome. The third pain point, all the administrative busy work. We're talking about manual note-taking, complex medical coding for billing, just endless paperwork. All of it eats up valuable time that doctors and nurses should be spending with their patients, not on clerical tasks that just lead to burnout. Fourth, you've got these major gaps in care coordination. Heart patients often see a whole team of specialists, their primary care doctor, maybe a cardiac surgeon, an electrophysiologist. If there's no shared system, critical information just falls through the cracks, leading to miscommunication, repeated tests, and missed updates. And finally, number 5, the huge challenges around compliance and security. Patient data is incredibly sensitive, and it's governed by really strict privacy rules like HIPAA. Trying to manage that with paper-based systems or a patchwork of digital tools makes it incredibly difficult to keep data secure and stay compliant. Okay, so we've laid out some pretty big challenges. So what's the solution? Well, this is where specialized electronic health records, or EHRs, come into the picture. And they're a truly transformative technology for cardiology. This slide just illustrates the shift perfectly. We are moving away from the old way, disorganized paper files and separate data silos, to a new way where every single piece of information comes together to tell one unified patient story. We're going from a fragmented history to instant, complete access, which turns all that wasted time into a smooth, streamlined workflow. What's so great about this is how it really visualizes what these systems do. A specialized EHR pulls everything together into one place, creating a complete story for each patient. It also helps coordinate care across the entire medical team, making sure everyone is on the same page. And it even paves the way for advanced tools like AI that can help predict risks before they become emergencies. So what is a cardiology EHR exactly? It is so important to understand that this is not just a digital filing cabinet. It's a fully integrated platform that pulls every single piece of a patient's cardiac data, notes, EKGs, imaging, labs, you name it, into one single, real-time, instantly accessible digital chart. Everything is right there, in one place. Of course, the biggest question is, does this stuff actually work? Does it make a difference? So let's dive in and see how this technology has been proven to transform patient care by looking at the hard data. One of the most significant impacts is on patient safety. Because you have a complete digital record, these EHR systems can run automated checks in the background. For example, they can instantly flag a potential allergy or a dangerous drug interaction before a doctor even sends the prescription. They stop errors before they can happen. And the data on this is powerful. One major study found that hospitals using fully electronic EHRs saw a 17 to 30% reduction in the odds of in-hospital adverse events for their heart patients. I mean, think about that. That is a massive, massive improvement in patient safety.
And the evidence just keeps piling up. Other studies have shown things like a 31% lower risk of complications after a procedure and 21% fewer adverse events in general. And this happens because of smart features like automated alerts for a critical lab result, say a high troponin level that could signal heart damage, or even system prompts to make sure crucial follow-up care happens.
Now, beyond just safety, EHRs also completely change the patient's role in their own care. Patient portals give people direct access to their own health info. They can see their lab results, get educational materials, and message their care team. And this kind of engagement is directly linked to patients sticking to their treatment plans and being more satisfied with their care. And of course, this technology is not standing still, not by a long shot. The foundation has been laid, but the evolution of digital heart health is really picking up speed. So let's take a quick look at what's just around the corner. We're seeing the future unfold in 4 key areas. First, more advanced AI and predictive analytics. Think of algorithms that can spot atrial fibrillation risk years in advance just from an EKG. Second, much better interoperability, so different hospital systems can finally talk to each other seamlessly. Third is integrated telehealth and remote monitoring, with data from your watch or home device flowing right into your chart. And finally, a big focus on patient-centered mobile health apps that put even more control right into the patient's hands. So when you put it all together, we've reached a point where a good EHR system isn't a nice-to-have anymore. It's become just as fundamental to practicing cardiology as a stethoscope or an EKG machine. It's truly an indispensable tool for modern heart care.
And that really leaves us with one final thought to chew on. We've seen how just organizing data has already transformed the field. So the real question now is, with AI, wearables, and predictive tools all on the rise, how is all this new data going to shape the next generation of heart care? Because the potential is really just beginning to be unlocked.